Couple of headlines on healthcare. Anthem pulling out of Ohio's Obamacare market next year. That leaves maybe 20 counties, up to 20 counties, with no insurer on the exchanges at all. Senate Republicans are outlining their new healthcare plan, and joining us is Senator John Barrasso, Republican, Wyoming. He is a medical doctor. Senator, without going into all details about your plan, what chance do you think you've got of getting Senate Democrats, some of them, on board your plan?
I would love to have Senate Democrats involved, Stuart, but what you've seen last week in California, the California State Senate passed a universal health care plan for the state of California. The budget point, Stuart, is $400 billion. Yeah. And in California, let's face it, their entire general fund is only $190 billion. So what they want to do is spend twice what they spend to run the whole state. It's not practical, but that's where the Democrats are headed. Universal plan, kind of like they have in England or Canada. You know how those systems work. That's not what the American people want.
Okay, so can you pass your version of Obamacare reform and repeal? Can you pass your version with 51 votes in the Senate? Can you get those votes, and will that apply, a 51-vote rule?
Well, I believe that we can. We're working on that. We had another very productive meeting yesterday. All of the members of the Republican conference were there, realizing that the current situation now really is not sustainable. While we were meeting, Anthem pulled out of Ohio. As you mentioned, 18 to 20 counties, no one offering plans. Over the last 4 years, what we've seen is the costs going up double across the country on the Obamacare exchanges. So we have to act. We have to rescue, provide relief for the people that are being harmed so much by Obamacare right now.
Now, earlier on the program, we had Congressman Louis Gohmert. He's in the Freedom Caucus. I know he's in the House, but he's in the Freedom Caucus. And he says, look, to get this tax reform done, to get it done, we are prepared to work through the August recess. Now, I took that as a declaration of intent, a statement of intent, that the Republican Party understands you gotta do it. Is that the message that you're picking up as well?
Well, and you mentioned tax reform. I'm focused right now on getting health reform done before the summer is done. So we need to focus on health reform right now. And let's take a look at why we're here. We are here because so many people are suffering. We want to get rid of the individual mandate. We want to give people more choices. We want to get the decisions made at the local level, get states more flexibility. I was in the state Senate in Wyoming, and I will tell you, Stuart, we always felt that we could do a much better job if we had more responsibility and did it our way rather than Washington telling us what to do, which is what Obamacare has done. It said Washington knows best. Stuart, Washington does not know best.
One quick question. How are you going to deal with Medicaid?
Yes. Well, Medicaid, you know, the issue is it expanded in some states, didn't expand in other states. Medicaid, originally, for children, for the elderly, the disabled, people that needed specific help. With the Obamacare plan and the expansion, it's to able-bodied, working-age individuals. Those are not the people that should have been on Medicaid in the first place. We need to reform Medicaid, put it on a sustainable path. It's not on a sustainable path right now. It's a failing system. About 1 out of 3 doctors won't even take new patients on Medicaid, but yet the Obamacare answer is put more people on Medicaid. That has failed. We have better ideas.
Okay. Senator, thank you very much for joining us, sir. Much obliged, as usual.
Thank you, Stuart.
Thank you very much.